C2B Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Stephen Laski. He graduated from New York Chiropractic College, did his clinical internship at the Rhode Island Spine Center under the mentorship of Dr. Donald Murphy, and has also been a part of the Student American Chiropractic Association. Most recently, he's volunteered as an evidence-based primary spine care doctor in Mocha, Dominican Republic. There's a World Spine Care Clinic there. So, Dr. Stephen, thanks so much for being on the show.
No problem. I'm glad to be here.
Yeah, glad to have you here. I really want to, learn more about World Spine Care and what that is, how it was created, why it was created. So I wonder if you could talk a little bit about your origin story with the organization and why you got involved.
Sure. I actually learned about World Spine Care back in October of 2016, about 2 months before I graduated. I was attending the North American Spine Conference in Boston that year, and I was popping around to some of the lectures, and I had wandered into one that was talking about the Global Spine Care Initiative, and I was like, I've never heard of this. I don't know what this is, but it sounds interesting. So I wandered in, and Margaret Norton, one of the members who was involved with World Spine Care, was actually part of a panel with a few others who are involved with World Spine Care, and they were just going through this program that is based in several clinics around the world, and the work that they're doing to basically take on the challenge of low back pain and neck pain as the global cause of disability. And it just sounded like such a cool concept about how they were going to different locations and just setting up this clinic to work with local people and provide relief for back pain, which is such a huge issue in a lot of third world countries, because if you can't work, you can't really live your life in those areas. So I looked into it a little bit more as I came back and realized that, graduation was looming a little bit closer and closer every week, and nothing really was panning out, in terms of a job that was, really exciting to me. So I had applied to Jeff Outerbridge. He's the clinical director for World Spine Care. Got in touch with him, and we started talking, and before I knew it, he was asking me if I was ready to come down to the DR for, a good amount of time. And I was like, you know what? Nothing else is lined up. This is probably the best opportunity I'm ever going to have to leave the country and go practice chiropractic somewhere. So I had to say yes to it.
That's great. And can you talk a little bit about what is different about World Spine Care as opposed to like a mission trip or something? It seems like a lot of students are doing mission trips these days. What you're talking about in the DR sounds similar, maybe you can create some differentiation there.
Sure. So I think the biggest differentiation between a mission trip and what World Spine Care does with the clinics and the locations that they have is that the mission trips are fun. You go there for a set amount of time, 7 days, 10 days, 14, whatever it may be, and you go and you get to help a huge amount of people in one small window. But then you go home, and that's the thing. And if you think about a course of care in the real world, you don't just treat somebody once or twice. Maybe you do sometimes, sure, it happens, but realistically, you're not providing them with the long-term sustainable care that they need. So for some people, it's great practice to go help out, and you're doing a great thing. But at the same time, to me and to a lot of other people involved in the organization, if you want to make a lasting impact, it's more beneficial to be there for a longer period of time and see a patient through their length of care. And I think that's what really separates a mission trip from what World Spine Care is aiming to do.
Yeah, so these are like established clinics, and maybe they have rotating doctors, but at least people have this continuity of care, and they're able to exactly receive the care that they need, and hopefully get better. I mean, that's the ultimate goal, I'm sure. Yeah, that's the goal. Obviously, we do have clinic supervisors who do a however long term. Like my term was only 6 months because that was what I felt comfortable with, dealing with loans and all that coming right out of school. But there are some clinic supervisors who have been there for, over a year and a half, 2 years, 3 years. And that is just a commitment to this purpose that is above and beyond what a lot of people are willing to do and capable of doing. Yeah, that's really remarkable. You talked a little bit about the clinics. How many clinics are there? Where are they located? Do you have that information top of mind?
Yeah, yeah, it's no problem. We actually have 6 clinics as it is right now. We have the one in the Dominican Republic. We have one in Ghana, one in India, and then we actually have 3 now in Botswana. Shishong and Mahalape were the 2 first that got down there. And then within the last year or so, we actually had one open in Princess Marina in Gaborone. So that is now located within a hospital setting and is quickly becoming like the focus area for the Botswana clinics.
So exciting. That's awesome. And at each of these locations, how many doctors usually, or how many chiropractors are usually part of, the clinic? What can you expect if people wanted to check it out?
So that varies a little bit. For example, my clinic, I was the only clinic supervisor there, aside from my training period when I first came down, that little transitional role. Botswana is a little bit different. Typically, there are 2 clinic supervisors that switch between the 2 locations. They'll do, let's say, 3 days at one clinic, 2 days at the other. Princess Marina and Gaborone is functioning a little bit differently now as well. So there's more people in Botswana typically. We have one over in Ghana right now, and I believe we have 2. It might have dropped down to 1 over in India. So it's usually at least 1, possibly 2 most of the time.
Awesome. So, with so many people on deck, like what are the results that you've been seeing? Are the results being tracked? Is there a research arm to World Spine Care that's kind of seeing how this is making an effect on low back pain and chronic pain being the leading cause of disability?
Yeah, so there's actually a huge research push with World Spine Care. As a clinic supervisor, we record all of our data for each day. I mean, patients seen, what it was that for you, if there was a new patient, what their diagnosis was, how you're treating, length of care, outcomes, if they happen to drop off, all that kind of stuff. And it gets entered into our collective database, and it's examined by our actual research committee, who is full of a lot of smarter and better chiropractors than I am. But they are putting out some really good stuff. There was actually a recent paper that just got put out by World Spine Care. Jeff Outerbridge was involved with that one as well. I think it's actually coming out in the lumbar spine textbook or chapter paper. I have to look at that again, but there's some good work coming out of there. And a lot of the research that we have actually gets pushed over to that Global Spine Care Initiative as well. And that's also one of the brainchilds of Dr. Scott Haldeman. So he's behind both of these as well.
So World Spine Care and Global Spine Care Initiative are kind of 2 separate initiatives that were created by the same person.
Yes, basically. So I would say World Spine Care is the umbrella of the 2, and that Global Spine Care is that little shift off to the side that's kind of functioning as its own to collect the data, show the research about how evidence-based care for low back and neck is just needed so badly, but really not being implemented as well as it should be. And the biggest thing for that is by going around to these locations and trying to implement these programs that are evidence-based and sustainable, it helps those areas in the sense that they're getting care set up early on, because a lot of times a third world country will model their healthcare systems after, the US or Canada or some modernized area. And not to knock what we're doing, but we don't always have it right ourselves. So instead of having that pop up more and more and more and having other people possibly not obtain the best results, as in some cases back home, it's better to implement this evidence-based system early on so it takes roots very early, can grow and just be established as soon as possible, because these are people who are not only not getting care, but they need it in some cases a bit more than the people back home.
Yeah, I'm really glad you brought that up. I think of like China and how acupuncture is just integrated into the medical mainstream, and so what what the organization is doing is integrating these manual therapy modalities into the medical mainstream, so they don't just have to take, the drugs and surgery approach that is common in America, which works for certain cases, but doesn't work for every case. And so giving people these alternatives. Right.
No, it's sorry, that's my dog throwing stuff around all over the place. No, it's definitely neat. I mean, there were a couple patients I saw, and I was told off the bat, like, if you go do this, you're definitely going to see a lot of things you wouldn't see off the bat, that back in the States. And I was like, okay, I understand that. But just seeing how quickly some patients respond to a few treatments, so simple. And then you see things you wouldn't see, like, off the bat. I was down there and I saw 3 cauda equina cases in 6 months, and it's not too often that you see one back in the States to begin with that someone else hasn't at least caught or kind of questioned a bit already, So the gap is huge.
Yeah, and how was that with the language barrier? Did you feel like there was much of a language barrier? There were translators? Was it pretty easy to, do the clinical consult and get the information that you needed?
So I was actually really fortunate in the fact that I had taken Spanish throughout high school and I touched on it in college. So the first couple of weeks, it was just a lot of, integration blown into my face, just trying to pick up on things and remember. But I was definitely lucky in the sense that Steven Eberspecker, the clinician down there before me, not a drop of Spanish. And he was always making fun of me saying, "You've been here 2 weeks, you're speaking way better than I have already, so you'll be fine." But we do have a translator down there as well. So that's a huge, huge bonus because there are so many little nuances in language for going through a patient's history that don't carry over the same. So, for example, in the DR, when someone says, okay, well, let's say I ask them, okay, how's your pain? And to them, they'll be like, oh, it's tired. You don't quite think about your pain as being tired back here, but for them, tired's like, oh, I'm sore and I'm achy, and it doesn't carry over the same. And some people are a little bit more reserved about presenting their pain, whereas other people in other areas and cultures are very, emotional and over the top, and it varies so much location to location. It's literally critical to have that person who's familiar with breaking down the little nuances so you can dig down to the roots and get the results that you need to get to.
Yeah, which is like that in the States too, right? I mean, there's still a language barrier, even though we're all speaking English, because everybody kind of interprets, their pain differently. So let's say, I'm a student, I'm watching this interview, I'm inspired to get involved with World Spine Care. I'm still in school, maybe for myself, I've got 6 months to go. What would you recommend in terms of like the next steps to get involved? Like what are your recommendations for that?
I would say close graduation, considering something like teacher, and you just definitely get in touch with myself or Jeff Outerbridge, anybody on the World Spine Care really, and think about it in terms of how long you'll be able to volunteer for. World Spine Care is always looking for volunteers, even if it's 3-4 weeks at one of the locations. But if you're willing to commit to a little bit more time and actually be in that role of clinic supervisor at one of the sites, take a real step and think about, is this something I want to jump into? Is it something I want to immerse myself in first thing off of practice? Because having done it that way, it's a big jump. And not to say that it's not rewarding, because it is entirely, but it's also very challenging. Not only do you have all of your new doctor jitters that come regardless, you're doing that in a different country with people you're not, entirely familiar with, and just sometimes it's a culture shock on top of all that. So it's a lot to take in. But factor that in. Think about whether you can afford to be there financially. I know that's usually a big challenge that a lot of new students, including myself, are facing. And, even doctors now who post interest in coming to World Spine Care, it comes down to, can they afford to take time off of practice to do this work that they're willing to do? But, the world runs a certain way, and it's hard to get around that sometimes. I would say also, if you are interested in World Spine Care, find a way to just come support the cause. We're always looking for people to just, give donations, because we are a nonprofit charity-based organization. Everything is done pretty much through the goodness of whatever we can run on. And just reach out, ask questions, because I had so many questions going into this, and the biggest help was just talking to people who had already done it and knowing you get to be reassured. You have a team behind you when you do have questions, even when you're in the midst of all the craziness getting down there and just settling into life. It's probably one of the best support groups in terms of professional advice I've had so far in practice.
Yeah, I mean, that's so important, right? To have that professional support group, especially as a new graduate. Is it required that you have your DC license before you volunteer, or could you volunteer, as a student or in that time frame after you graduate and before you actually get your license?
So you do have to be licensed in order to be down at any of the locations. You have to have graduated from a chiropractic college, university, and be licensed in some state, territory, country, area, whatever it may be. For the sake of making things easy on myself, I decided to get a New York license because that was also home at the time. Right before I left, it was going to be a lot quicker than getting like a Massachusetts or North Carolina. And that's also a big challenge that a lot of people face. We have had students who are interested from Canada, but let's say they graduate in April or May, some of them don't receive their certification for licensure until July, August, and it pushes them off of that 3 months. That's a gap that a lot of people would love to be down there for, but they just can't, because we do have that stipulation where we need you to be credentialed as a professional healthcare provider in those areas.
Yeah, perfect. Thank you for that clarification. I think that's important for students to know, if they're considering doing something like this. In terms of, so you have your license, you've contacted the organization, then, do you get to pick a location, or is there like a certain need in terms of the organization and they ask you to choose a certain location?
So we're never going to turn down anybody who is willing to commit to it. Like if you are dead set on going to Ghana, then that's definitely an option. But there are for sure areas that are in more need of somebody than others. For example, the Dominican Republic is always a challenge for us to get people down there. We had a short period in time where after I had left, we had to temporarily suspend the clinic because we didn't have anybody ready to get in there behind me. We do have someone there now, and she's been there since February, but her time frame is also coming to its end as well, and we don't have anybody who is 100% committed to it as well. So I would say that the DR is our priority clinic in terms of getting somebody down there, getting them set up, and just continuing the show for not only the clinic itself, but for the continuity of the care for the patients, because it's tough to get someone set up and get them 75, 80% better, and then just have to up and leave and put everything on hold. And yes, it sucks for World Spine Care to have to do that, but at the same time, it sucks more for them because that's why we were there originally. It's very tough to do. The DR is for sure our number one spot that we try to fill. And I would say behind that, Botswana usually gets a lot of attention because it has the 3 locations and it has so many people that are usually rotating in and out there that it gets a lot of attention as well.
Okay. Yeah. And do you have any recommendations in terms of training? You have a pretty specific skill set with evidence-based primary spine care, certification and training. In terms of people wanting to get involved, is there any training that you would recommend prior to getting involved that would really give them the clinical skill set to really succeed while they're there?
Yeah, absolutely. I think I'm a little biased in saying this, but the CRISP protocol books are a foundation. If I had to describe the best way to just put the cement down for the chiropractic house you want to build, for a lot of people that covers so much, because it takes you through neck and low back, which are 2 huge categories of what you will see as a provider. And it just gives you so much insight and a system for how to go about evaluating a patient, making sure there's nothing serious, figuring out what the root of the cause is typically, and then addressing those secondary factors, yellow flags, stabilization things, psychosocial, all that kind of stuff. And then if you want to get more specific in terms of like your rehab, nutrition, whatever you want to do, you can always put that on the 2nd, 3rd levels and go from there. But if you don't cover the big bases, I think that's, something that's kind of hard to get around because you can miss something. And does it happen? Sure. Does it all the time? No. That would be my personal recommendation. The PSP class does have a cohort at University of Pittsburgh. So if you have the means and the finances, you can definitely look into that. They'll be opening up another class coming end of this year. And I think they're also planning to do a cohort over in LA starting possibly fall of this year, I think too. Aside from those, just trying to stay on top of the research. I mean, I try to get an article in once a week, hopefully, ideally. I actually write the date that I printed out on so I can kind of remind myself, be like, wow, you missed this one 2 months ago. Great job. But yeah, just trying to stay up on the things like that. And if you're any of the Facebook groups like Evidence-Based Chiros or, Forward Thinking, like so many brighter and smarter people in there than I, like, will just leave these tidbits of things to look at and, learn from. If you don't have the means to go pay for a class like ART or Factor or whatever it is, DNS, go through the research and just pick through it and find something that is relevant and makes sense to you and just learn as much about it as you can that way. Because research isn't always free, but there's always a way to kind of get around it if you look.
Yeah, and most students have access to a lot of research articles, so definitely a great time to do that while you're in school, because you'll never have better access than while you're associated with the college or university. So next steps for chiropractic students: go to the website, contact, volunteer, donate. Is that kind of the best place to go? Do you guys have a Facebook presence? Like, what's the best place to really connect?
So definitely check out the worldspinecare.org website. We have a huge amount of information you can just pick up off the website itself. You can click on some of the clinic supervisors, see their story, their background, get familiar, but you can also contact info@worldspinecare.org as well. If you want to send an email directly to me, that's fine. I'm actually chairing the volunteer recruitment committee, so send all your questions to me. I'll be happy to get back to you. I can give you the link for my email at the end of this if you want as well. But just piece through it, see what there is. And if you want to do something like the Workaday Challenge, where you're a provider and you decide you want to commit, half of the funds you make that day towards World Spine Care, that's probably one of the best things to do, because we do ask for a small $500 donation for people who want to come volunteer for, let's say, 3 weeks or a month. And that basically helps to cover your expenses while you're there. And that's easily taken care of through the Workaday Challenge.
Awesome. That's great advice. Well, I hope a lot of chiropractic students, get involved and do this. I feel like this is so much better than a mission trip because of that continuity of care, and also the resources that you have behind you, those professional mentorships, networks, that ability to really, learn instead of just practice, which a lot of the mission trips provide. So yeah, thank you so much for coming on the show and sharing everything that you did today.
Not a problem. It was great being here.
Yeah, likewise. So this has been a production of DC2B Revolution, helping chiropractic students think big to live large. If you like this interview, please subscribe to the channel, leave comments in the comments section below, like this video. We always love hearing from people, and this is such an important subject. I hope everybody will get involved or find a way that they can look at the broader impact of what we have to offer here as manual therapists and chiropractors. So